Welcome, everyone, and thank you for joining us today on our webinar on hearing loss, Determinants to Equity Care in the Black Community. And it's hosted today by the National Caucus and Center on Black Aging Incorporated, NCBA, and it's presented by the Hearing Loss Association of America, HLAA. Our first presenter is Barbara Kelly, the Executive Director of HLAA. Barbara joined the organization in 1988 and became Executive Director in March of 2016. As HLAA's Chief Executive Officer, she is the primary spokesperson for the organization. She is responsible for overseeing the administration, programs, and strategic plan of the organization, and she is responsible for fundraising, advocacy, marketing, media relations, and national and international outreach. Barbara also served as editor for the award-winning magazine for 28 years. As Deputy Executive Director from 2008 to 2016, and she serves on various boards and coalitions, among them the National Institutes of Health Council of Councils, DPCPSI. She's a member of the National Institute on Deafness and Other Communication Disorders, Advisory Council of the National Institutes of Health. Barbara published her own digital magazine, Celebrate Home. She blogs about food and hospitality and has a video series on how to be the best host. Thank you, Barbara. Welcome. Our second presenter is Letitia Porter Vaughn. Letitia Porter Vaughn, PhD, is the president of the HLAA New Jersey State Association and is a paralegal at Seton Hall University Center for Social Justice. Letitia is co-founder of the HLAA Essex County chapter and a Deaf Snapshot mentor of SPAN New Jersey. Letitia was born with hearing loss, but was not diagnosed until age 19. She has published 2 books about hearing loss and says the HLAA community of support helped to empower her to live well with her hearing loss. Letitia enjoys helping others to thrive, and she advocates to thrive and advocate for themselves. Thank you and welcome, Barbara. The floor is yours.
Thank you, Angela. It is such a pleasure to be here, and thank you for focusing on this important topic of hearing health and hearing loss. And hi, Letitia, and hi, everyone who's on this webinar today. I'm going to share my screen and talk a little bit about hearing loss, but mostly about hearing health and why we really need to pay attention to it. Okay. First of all, I'll tell you a little bit about the Hearing Loss Association of America. We're a national organization, and we're mostly, our community is people who have hearing loss, all ages, all degrees of hearing loss, people who want to stay in the hearing world with technology, whether it's hearing aids, cochlear implants, captioning, most people who weren't born with hearing loss, but might have aged into their hearing loss, maybe mid-career or later in life. But we're the leading organization who represent the growing number of people who have hearing loss. You know, you might have hearing loss yourself or think you have a hearing loss or know somebody, because 1 in 7 people in the United States has some degree of hearing loss. And HLA here is to help improve the lives of people who are dealing daily with hearing loss and their families who are also dealing with it as well. But most important, we want to raise the awareness that hearing health is a part of everyday health. It's a part of overall health. I mean, your blood pressure is important, your glucose levels, your weight, all of that, as well as your hearing health. And we also focus on public policy with accessible communications. For example, you might not know, but the cell phone that you use is most likely hearing aid compatible because our organization works with the FCC and with the wireless industry to make sure that these regulations are in place. So that's some of the behind the scenes work. But I think what, Letitia is going to talk about and Angela referred to, that HLAA is a community of support of people who have hearing loss. We have chapters across the country, and we have the Walk for Hearing in 20 cities. And, hearing loss doesn't discriminate. It doesn't matter what your background is, what your age is, what your color of your skin is, or your nationality. Hearing loss is hearing loss. And people who connect with us, I'll meet people all the time and they'll say, I'm having trouble hearing, or I wear these hearing aids and although my hearing aids are great, I'm still having some problems. And they'll say to me, have you ever heard of anybody else having problems like this? And, I think this is the feeling that people feel they're the only one in the world who has a hearing loss. So that's where our community of support and our resources really try to help people. In the past year, hearing health has been in the news now more than ever. And I know from our own experience, national media has reached out to us to comment on hearing loss and hearing health. Here you see a picture. I was on the PBS NewsHour. We had an article in Prevention Magazine, the AARP Bulletin, which I think all of us over 50 probably get. So hearing loss is now in the mainstream national media and getting the attention that it deserves. And one of the reasons is because last year at this time, the FDA opened a new category of hearing aids that could be sold over the counter. Now, this got a lot of press because sometimes in the press, you would just hear, now you can buy hearing aids over the counter and they're cheaper. Well, we got the chance to clarify that. They're only for adults with mild to moderate hearing loss that is self-perceived. But what it did was there's prescription hearing aids, which you can get through your audiologist or a hearing aid specialist. But now there's another pathway to care for over-the-counter hearing aids. And I know this is confusing. Maybe we can help clear it up today with some of your questions as we go along. But what's important is that hearing health is in the news and it's part of overall health. And, many of us over 50 will go to our family doctor or a nurse practitioner, somebody who cares for our health, and will say, I'm having a little problem hearing. And I hate to say this, but very often we're dismissed. We hear, oh, don't worry about it. It's a natural part of aging. Or don't do anything about it till it gets worse. Or you can't do anything about it. Well, all three of those statements, there's so much wrong with those. And first of all, you can do something about it. It might be part of aging. It might not be, but you can do something about it and you shouldn't ignore it. And you shouldn't wait till it gets worse to do something, because all our relationships, everything we do from the minute we wake up to the minute we go to bed, whether it's enjoying something in retirement, doing volunteer work, doing paid work, going to school, all our relationships depend on hearing. And that's why it's so important. Untreated hearing loss, we know, leads to isolation, depression, enjoying social events, even things like eating out in a restaurant. It can cause anxieties. There is a link with falls, and falls are the number one reason that older people go to the emergency room. It interferes with our work life, with employment. Some people don't want to get hearing help because they think it's going to make them look old. Well, I like to tell people what makes you look old could be not hearing a conversation correctly or giving inappropriate responses. That's so much worse than wearing a hearing aid. And we also worry about cognitive decline. And I use this picture here because during COVID, I think, hearing loss is isolating enough. And then we had to withdraw from people, and it was just an added layer of isolation. And people found out that even with mild hearing loss, if you put a mask over your lips and that muffled the sound, communication became really difficult. So we offered some webinars, which all are available on our website, free, they're captioned, about some of the things that people did during COVID, like using speech to text apps on their phones. So if they ended up in the emergency room because you weren't allowed to bring in your partner or your kids, you were there alone, people would use speech to text apps, things like that. But I talked about, we found that better hearing equals better living, better thinking, more engaged, talking with people, staying in touch with the things you like to do. Better hearing equals better living. And that's why it's so important to pay attention to hearing health. We do have this resource on our website because so many people had questions about over-the-counter hearing aids. They could be for some people, for example, maybe you're not ready to wear a hearing aid from morning to night, 7 days a week. And you might need some situational hearing, maybe when your family's over at the dinner table, or where you need to hear in a meeting or at some event that you want to be at, where you just need a little enhanced hearing. But the point is, we know that from the time a person finds out that they have a hearing loss to when they actually jump to treating it can be 5 years. And as I said, a lot can happen in that 5 years in breaking down of the enjoyment of life and being with people and enjoying relationships. So our hope is that maybe for some people, an over-the-counter hearing aid will be that first step into taking some type of action. But I can't stress enough that, technology is one thing, but, hearing aids work, they're great, but that isn't all there is. You really do need a community of support, or just knowing that there's resources available that can help you figure this out. And I just love this picture. And in fact, I just want to tell you all the pictures that you're seeing in my slideshow are HLAA people. There are folks. These are not stock photographs. And, just showing people supporting one another and people who associate themselves in one way or another with HLAA. Maybe they just get our free e-news or attend our webinars. But I really want to show you this next slide, because we have the Walk for Hearing in 20 cities across the country in the spring and the fall. And I have to tell you, this is where we see the kids come out, which I love seeing the kids. I'm a grandmother. I love seeing kids. But the parents come out with kids who have hearing loss. And that child could be, for the first time in their life, because they're mainstreamed into school, realize that there's another child like themselves who might wear a hearing aid or might wear a cochlear implant. And the parents get to share resources. But we have a lot of older folks who come out as well, who bring their family and their friends. And it's just a great day of fun. So I encourage you, if there's one in your city, we have a couple more this fall. This coming weekend, we've got Philadelphia, Washington, D.C. It's a great day. But I just want to show you this video because it always makes me smile every time. So here we go. You can see why that makes me smile every time. It's in our Walk for Hearings where we really see that community and the culture and the feel of that community come out. So if I'm going to leave you with anything, I want to leave you with, if you think you have a hearing loss, you're not alone. There's something you can do about it. And please make your hearing health part of your overall health. And now I'm going to turn this over to, once I get out of this slide, no, we don't want to see it again. Letitia Porter-Vaughn. As Angela gave her that beautiful introduction, she's a member of our organization. She's a mover and shaker in New Jersey, and so much so that we featured her on the cover of our magazine, Hearing Life. So Letitia, I'm going to turn it over to you. And just thank you, everybody, for coming today. I wish I could see you all, but I hope you enjoyed that.
Thank you, Barbara. And thank you, Angela. Thank you, everyone, for having me today. And we'll start with my story, the prevalence of hearing loss within the family. In our family, hearing loss has persisted as a shared challenge across generations, touching the lives of my great-grandmother, father, grandmother, and great-aunt. What's particularly noteworthy is that I, too, was born with sensorial hearing loss, a condition that went unnoticed until I turned 19. This enduring history of hearing difficulties in our family serves as a powerful reminder for our African American seniors. We must actively acknowledge and tackle the issues within our community, stressing the significance of early detection and raising awareness to ensure that we all receive the support and care we need. The importance of sharing family hearing loss experiences. Growing up in a family where hearing loss was a shared experience opened my eyes to a world of awareness. Within my family, I witnessed the unique journeys of my loved ones, each wearing hearing aids, and how they diligently saved money for treatments and support. This firsthand exposure served as a profound educational tool, offering valuable insight into the importance of early detection, prevention, and the availability of resources. For instance, my father, an honorable discharged serviceman who celebrated his 89th birthday in June, and he lived alone, has been utilizing a VA for his hearing loss treatment. His journey, along with my grandmother's and great aunt, showcased that hearing loss need not be a barrier to fulfill a quality life. They worked, enjoyed social activities, and actively participated in the community, all while managing hearing loss. This experience resonated deeply within our family, extending to our friends and the broader community, where their hearing loss was known and accepted, inadvertently creating a network of coping strategies. This environment cultivated a lack of stigma associated with hearing loss, contrasting with the unfortunate reality that many individuals face. However, even with this supportive backdrop, I remained unaware of my own hearing loss until the age of 19. The knowledge of my family's experiences empowered me to take control of my hearing health and advocate for my needs. By sharing these experiences, we raise awareness not only about the prevalence of hearing loss, but also about the unique challenges faced by older Black individuals within our community. Sharing these stories can serve as an educational tool, providing insight into the importance of early detection, prevention, and available resources for hearing loss. It breaks down the stigmas associated with hearing impairment, fostering an environment where seeking help and utilizing hearing aids or support becomes more socially accepted. Sharing experiences can facilitate the creation of support networks, enabling individuals to connect with others facing similar challenges and share coping strategies. Encouraging individuals to share their experiences empowers them to take control of their hearing health and advocate for their needs within the healthcare system. Barriers to care and treatment for Black individuals with hearing loss. While my family's experiences have been instrumental in overcoming some barriers associated with hearing loss, it's essential to acknowledge that not all individuals have the same support system and access to resources. In particular, the Black community faces unique challenges when it comes to hearing health care and treatment. Let's now delve into some of the barriers that disproportionately affect Black individuals with hearing loss and explore ways to address them. Many Black individuals face disparities in healthcare access, making it challenging to receive timely and specialized hearing care. The cost of hearing aids and related treatments can be prohibitive for some, and financial barriers can prevent individuals from seeking help. In some cases, there may be limited awareness about available resources and support for hearing loss within the Black community. Cultural beliefs and stigmas surrounding hearing loss can deter individuals from seeking assistance, as it may be perceived as a sign of weakness or aging. Language differences and communication challenges can further complicate access to care, especially if healthcare providers are not culturally competent. A lack of representation of Black individuals in hearing health awareness campaigns and research can contribute to a lower understanding of the unique needs and challenges they face. HLAA plays a vital role in empowering individuals with hearing loss while promoting equity. HLAA provides us, adults and children, with valuable tools and resources for self-help. This empowerment equips us to better navigate the complex landscape of hearing loss, ensuring we can lead fulfilling lives. The organization fosters a supportive community where we can share experiences and solutions. By connecting with others who understand our journey, we gain a sense of empowerment and unity that can be truly transformative. HLAA commitment to equity, equity in action. Fostering a society where everyone understands and accommodates the needs of those with hearing loss, promoting equity in communication and inclusion, building a supportive community, creating a sense of belonging and unity among individuals with hearing loss, reducing feelings of isolation, and promoting equity and emotional well-being. Encouraging knowledge sharing about hearing loss, providing everyone with equitable access to information and support, promoting inclusion through raising awareness about the nature, causes, complications, and remedies of hearing loss. HLAA reduces the stigma associated with this condition. This is a significant step towards a more inclusive society. Equity in access. The organization ensures that we have equitable access to essential health resources. This eliminates disparities in support access that can affect marginalized communities like ours. Supportive community building. HLAA creates a sense of belonging and unity among individuals with hearing loss, reducing feelings of isolation. By encouraging knowledge sharing about hearing loss, they ensure everyone has equal access to vital information and support. Advocating for equal opportunity. The organization actively advocate for policies and practices that secure equal opportunities and rights for us. This includes promoting equity in education, employment, and our daily lives, removing barriers. HLAA is committed to removing the barriers that limit our participation in society. By doing so, they promote equitable access to resources and services for all of us. Amplifying your voice, self-advocacy, and hearing loss. In the world of hearing loss, where the silent struggles are often overlooked, you must be your own advocate to live well. Your voice is the bridge to a life where hearing loss doesn't limit your aspirations. It's the key to unlocking doors, breaking down barriers, and reshaping perception. Embrace your power as an advocate, for only you can convey the unique needs and challenges you face. Through your advocacy, you not only improve your own quality of life, but also pave the way for a more inclusive world where understanding and empathy thrive. Your journey is an inspiration, a call to action, a testament to the resilience of the human spirit. Be your own advocate, for you possess the strength to turn obstacles into opportunities and to redefine what it means to live well with hearing loss. Thank you, everyone.
Thank you, Barbara and Letitia. Thank you so much for your thoughtful presentations. They were awesome. And at this time, I'm going to invite our audience to share their questions with us in the chat. And to kick it off, I have a few questions that I'd like to ask for myself. My grandmother has hearing loss, and she doesn't like to wear her hearing aids. In fact, my family has normalized talking loud just so she can participate in a conversation with us, and vice versa. Can I please ask you to share some strategies on how we as a family can get her to wear those hearing aids without making her forced to do so?
Oh, I'll go first and pitch it to Letitia because I think she has some experience with this. But this is not uncommon. And first of all, I just want to say your family's great for accommodating her. That's love, isn't it? And it's hard. It's hard. We have first of all, some communication tips on a tips card on our website that will help your hearing family members. It isn't always about talking loud. Sometimes it's slowly and clearly making sure there's no background noise. And then there's some tips for her as well. Like maybe she needs to say, instead of repeating that, can you rephrase it? And I'll just say one thing about hearing aids, that they're great. The technology has improved. But, if I put on my glasses, I'm going to correct my vision. It's pretty much going to be 20/20. When you put in a pair of hearing aids, it doesn't correct your hearing. Your brain has to adapt. Sometimes background noises are amplified and you don't hear the conversation. So that's why a lot of people don't put them in. They just say, I'm just not up today to dealing with that. Letitia, I bet you've got some gems to add to that.
Thank you for that question, Angie and Barbara. Actually, as you just heard, my grandmother and my father, they both had hearing loss. And it was a house, everyone talked loud to them, but they wore their hearing aids. My father was born in the 30s. My grandmother was born in the early 1900s. And when it came to their hearing aids, they wore them. And they would have you talk loud. And back in the 70s, hearing aids were crap. They just gave you a bunch of noise. So they didn't understand hearing loss. However, to help your family, I suggest take a little bit of examples of how hearing aids can help. Be patient. We need a lot of patience, people that have hearing loss. And for whatever reason she doesn't want to wear them, you can give her examples of why she should and just talk to her and just explain to your family, this is why you're not hearing and this is what you can't hear. But if you wear hearing aids, you might be able to hear this a little better. But you be very encouraging, soft, and kind of slowly help her embrace it, you know, because being older, people are pretty much set in their ways. They don't like change. And they definitely don't like you throwing everything at them. That is a no-no. They are not going to do it. But what you can do when I visit my father, because he don't really understand how I don't hear. He has my books and everything, but he really don't understand. And he gets frustrated with me when I don't understand him. So I don't pay him any mind. But slowly I tell him when I write him letters, I tell him how I hear and what I can't hear. And you can do the same thing with your family. Just giving examples, be patient with her, be loving with her, and just talk to her about it. And maybe she'll change her mind. But I think you should talk to her first and create stories behind it. We love stories. Even older people love stories.
Yes, yes.
Yeah. So you create a story behind it. You may reel her in, and she may start wearing a hearing aid.
Okay, well, I'm going to give it
Okay.
a try and I will let you know.
Okay.
And again, I'd like to encourage our audience members to ask your questions and put your questions in the chat, and we'd love to share them. And in the interim, I'm going to keep this conversation going. So my next question is about hearing health or audiology care. Is that type of care covered by traditional health insurance, Medicare, and Medicaid? And if so, if covered by both Medicare, Medicaid, is that considered preventative? And should one get an annual screening?
Boy, there's a lot packed in that very good question. So I'll try to break it down. And if I miss something, first of all, Medicare, traditional Medicare, does not cover hearing aids and services. Now, that's crazy. We realize that because as we get older, that's the higher prevalence of hearing loss is in the older people who are under Medicare. However, our organization has been working on that, fighting for that. There's reasons why it's not included, but it should be. However, a hearing assessment is covered by Medicare. You have to have a referral from your general physician to an audiologist to have that assessment, and you should get it. Medicaid is a bit different. Medicaid is usually administered by the states, and it is for lower income people, and that varies. In some states, hearing aids are covered. I think in the state of Washington, it's covered. So that requires a little bit of digging on your part. Medicare Advantage, which is the supplement to Medicare. It's, some people choose a Medicare Advantage plan or they choose something else out there. Sometimes people have TRICARE for life. If you're a veteran, you get TRICARE for life. But Medicare Advantage plans, some of them do cover hearing aids. But again, you've got to look at the plan and read the plan. In traditional insurance, if you're not under Medicare, you're under 65, say you're in a federal Blue Cross or Blue Shield plan, that generally covers hearing aids. But again, you have to look at your private insurance. It's really all over the place. And I know hearing aids can be expensive. And I just want to tell you, don't get discouraged. You can buy hearing aids, 2 hearing aids that run up there in $5,000 and $6,000, and they will have all the bells and whistles. In fact, they will even alert your family members if you fall, and they'll tell you what your blood pressure is, and they'll tell you what your heart rate is. I know most people just want to hear, but if that's important to you, you can pay that much. but you could also get two very good hearing aids. And I'm not promoting any avenue to care because there's avenues to care, but I would check your big box stores because very often they have a hearing aid specialist or an audiologist in those stores who can fit you and take care of you. So they kind of run the gamut. There are some programs that fund hearing aids. They're few and far between. You could go to our website and look at them. And also the other question was, should you have your hearing screened every year? I think you should. I think especially if you start having trouble hearing on the phone or understanding the words, you're turning up the volume on the radio or the TV. If your family members are telling you they think you have a hearing loss, good chances are that you do. And you could get some free hearing screening. Sometimes at our Walk for Hearings, the Lions Clubs or the Sertoma Clubs have a screening van right in your community. Maybe there's a county fair or a health fair. There's also, if you use a smartphone, there's apps on your phone where you can get a general feeling. Now, I have to tell you something. The U.S. Preventative Task Force Services came out with a recommendation last year that adults over the age of 50 who have no signs of hearing loss don't have to be screened.
Huh.
Now, if they would come out and say they do have to be screened, we know that every physician in town would line up and screen. And the only reason they came out and said that was because there's not enough data to show that if you screen somebody who has no symptoms of hearing loss, that it'll make a difference. So I'm going to dismiss that for now. We're working on that. I think if you think you're having a problem with these symptoms, get your hearing screened.
Okay.
Letitia, anything else to that?
While you're saying that, I'm thinking that hearing loss should be an annual checkup added to our insurance. And we should, the same way we go for eye care once a year, a regular physical, gynecologist, all of that, hearing loss should be added to that, where your doctor reminds you, okay, it's time for your hearing health checkup. I go every year. I have a regular, and I know everybody can't do that, but it should be added on as you get your hearing checked every year. So it won't be a surprise if you do have hearing loss. You always have that record to show that, okay, this problem started last year. And next year, if it keeps progressing, you may need hearing aids. And then that's the part of the hearing health care where we wish hearing aids were covered by insurance.
And Letitia, since it's not part of general care, when you go into the doctor and they ask you questions, have you gained weight? Have you lost weight? Are you feeling depressed? Right. Are you sleeping well? Do they ever ask you first, do you have a hearing loss or do you have trouble hearing on the phone? So some doctors do screen every year. Mine now does, but he didn't used to. And one day I said to him, in my annual physical, he always looked in my ears, right? And I said, doctor, you look in my ears, but you never asked me how I'm hearing. Well, we had a little discussion. We had a little discussion after that.
And the thing, most of us don't know that we're not hearing.
We don't know. And Letitia talked about being your own advocate, especially if they're not doing hearing screenings. If you think you're having trouble, please take it upon yourself to go get a free hearing screening. And if you tell your doctor you think you're having a hearing loss and he or she says, don't worry about it, don't listen. Just don't listen to that.
Well, I thank you both for that, because I am thinking of my own doctor, and Barbara, like you, he will put that scope in my ears, but we don't have a conversation beyond that scope. And so I'm certainly going to ask, why aren't you asking me if I'm hearing? No one's ever asked me that. And so thank you for that recommendation. And I'd like
to even follow you up with what my doctor said. after I said, why don't you ask me how I'm hearing? Well, it's just me and him in this little quiet room. He said, oh, well, I know how you're hearing. You're hearing me perfectly fine. And I said, doctor, it's a quiet room and we're face to face. I tell you, we had a great conversation after that. He actually said, okay, Barbara, I know where this is going.
Well, I'm going to take you up on that and let you know what happens. We've got some terrific questions in the chat, and I'd like to get to those. And one of them says, can you let me know if this is true? Once I heard smoking and high blood pressure can contribute to hearing loss. Is that true?
Letitia, you're shaking your head yes. I think smoking and what the other one, high blood pressure, could lead to anything, but I'm not a doctor. Letitia?
I'm not a doctor either, but I've had this conversation with my audiologist, and she spoke at one of our hearing loss chapter meetings, and she spoke about that smoking contributes to hearing loss. And one thing I do remember she's saying that we have to get oxygen in our ears to hear and understand, to keep our ears working, functioning. So smoking cigarettes impacts the oxygen going into your ears. So it does impact it. And I have a few friends that smoke and they're struggling with their hearing loss.
And when you speak to smoking, is that traditional menthol cigarettes? Would that include vaping, or just any tobacco, marijuana smoke, any tobacco, or is it certain type of smoking?
When we had the presentation, she was talking about the methanol, regular cigarette.
Okay.
She didn't mention the other thing that's going on.
Okay. All right.
Angie, since you're talking about causes of hearing loss and what can lead to hearing loss, we have to underscore protecting your hearing. Noise-induced hearing loss is completely preventable and it's completely irreversible. So, when you're out there mowing the lawn or using a chainsaw, you know what? I have this really loud hair dryer thing that I now use on my hair. It's really loud, and I put earplugs in my ears. So protect your hearing. Even if you have a hearing loss, protect what you have left.
Barbara, I'm so happy you said that, because as we talk, I'm thinking about those earbuds that we all use to listen to our music and to tune out the world or exercise. And I can't help but think cranking up that good music might not be so good for me.
Exactly. It's also duration of the sound. And I know in my iPhone, and this is not an ad for iPhones, but there's an app where you can set safety standards to noise level. And it also will measure decibel level, even if you're in a noisy restaurant. And it's really important. And we know that our teens are at risk. And if you can hear the music coming out of somebody else's headphones or earbuds, it's way too loud. And, we're all probably old enough now. We've been to concerts when we were younger and we came out, we had a muffled feeling or a ringing in our ears. That was a little bit of noise-induced hearing loss, destroying the inner hair cells bit by bit by bit. So I know people in my age category and the baby boomers are saying, you know what, I'm having trouble hearing. And it's from those years of assaulting all the rock concerts that we went to.
Indeed.
Can I say something?
Yes.
Angie? And I think a great research study would be on DJs.
Ah.
That would be the ultimate research study about listening to music too loud. They've listened to it so loud for so long that they think that they're normally hearing. And they probably have hearing loss. But because music is always up so loud, that's just normal for them, that decibel level. And they probably are losing their hearing and don't know.
Letitia, that makes me think of something. You know what? One of my favorite baby gifts to buy for a baby shower is, they're very popular, the little tiny baby earmuffs to protect their hearing. It used to be in the old days, we would take our babies to wedding receptions and the loud music that is so bad for the babies. Or take them to a big monster truck show. That's so bad. And now I see more and more babies wearing the little hearing protection. And I'm so glad to see that. So I've started buying that as a baby gift for people. You
That's
can
a
get them online.
great gift and a perfect segue to our next question about cleaning the ears and Q-tips. Can Q-tips cause hearing loss?
I said, no. Can I answer first?
Okay.
Oh, please.
My husband, he used to use a Q-tip, and instead of him using it around the ear, he was pushing the wax in his ear. So one day he woke up, his head was hurting, thriving. It went on for a couple of days. He finally went to emergency room. They took out wax about that long out of his ear, and he was pushing it in his ear. And then you can damage your ears from pushing the wax too far in. So you definitely, if you use a Q-tip, it's only for the outer parts of your ear, never for the inside. And wax automatically falls out. Wax will fall out your ear. You may wake up one morning, you feel something drop out, and the wax will just come out on its own. But you should never use a Q-tip to dig in your ear. That's a no-no.
And I'm going to add to that, and no other type of instrument to clean your ear.
No.
Hairpin, no nothing. Okay.
No. My dad used to take a paper clip.
Yes.
Yes, no. And that's the other thing. If you're having some of these what we call red flag symptoms, sometimes if you think you have a hearing loss, go to your doctor. It could be you have wax in your ears that need to be cleaned.
Mm-hmm.
If you wake up with a sudden hearing loss or you have drainage, don't go run to CVS and try to solve it or buy an over-the-counter hearing aid. These could be a medical condition, and go see your doctor and find out what's going on.
Okay. And then this is another environmental question, and it reads, does pollen and allergies affect hearing over time?
I don't know about over time. And again, I'm not a physician. I'm just going to talk from personal experience because I have allergies. And I know that everything stuffs up, including my ears. I mean, I feel like a muffled thing. Now, I don't know if that degrades your hearing over time. I don't know. Letitia, have you had any experience with the speakers at your meetings talking about that?
I haven't. Over the years, I did have allergies for a couple of years, and I would take medication for it. But I don't recall it really impacting my hearing. It may have, and I just didn't know. But my ears may pop like flying in a plane, and then when the symptoms clear up, it pops. But other than that, I've never had any issues with allergies in my hearing.
Okay.
And I think that's something, to ask your doctor, because we're not doctors to get that treated. I was going to talk on something else about, but I lost my train of thought.
Okay.
I'll get it back. It was something to do with medications. There are medications that can cause hearing loss, either long-term or temporary. These are called ototoxic medications. Aspirin is one of them. If you have to take aspirin in high doses, that's usually, and some of the water retention drugs will cause temporary hearing loss. Long-term hearing loss, we know that cisplatin, which is used in chemotherapy, in many cases causes permanent hearing loss. So it's always good to ask your doctor about a medication that they're prescribing. Is it ototoxic? If you can't remember that word, just say, does this drug cause hearing loss?
Okay. So we have another great question in the chat, and it reads, I live in an underserved community and I don't have health insurance. How do I get hearing health care?
Very often in underserved communities and in some rural communities, you can't even find an audiologist or hearing instrument specialist. This is another problem. I would say get free hearing screenings if you can come upon them. Letitia, can you speak more to this? It's really a problem.
Yes, I suggest the state see what the state offers. And people with disabilities, there are additional services that you can get from the state. They may be able to get transportation to go to get their hearing checked. But I think the biggest resource for them would be to contact the state and see what type of services they provide. For example, Division of Vocational Rehabilitation. They've always paid for my hearing aids because I never made any money.
That's great advice. That's great.
But they are a godsend. So if wherever this person is living, if they to contact the state and see what the state provides, and they probably can guide them towards other resources so they can get their hearing checked and start on the road of hearing health care.
Okay. And in Washington, D.C., where we are headquartered, NCBA is headquartered, oftentimes or before the pandemic, there would be vans that offer screenings. Sometimes they would have audiology screenings. Is it worth our time investment to participate in those screenings? And do we take those screenings as gospel, or should we just keep pushing and advocating for ourselves?
Those are often, take advantage of those. Those are screenings, not a complete audiological evaluation, but what it will tell is if you should be referred on. So I think those screenings are really important.
Okay. Then there's another.
Also, Angie and
I'm sorry.
Once you connect with the state and you get the resources you need, they kind of connect you with all of the assets, making things more accessible to you, especially if you live in an area where it's difficult getting to services that will help your hearing. But I remember when I saw an audiologist at 19 when I found out about my hearing, they just immediately referred me to the state. And I've been taken care of ever since.
Okay. Thank you. Thank you very much for that. And we have a great question. All of the questions are fantastic. But I mentioned it, this question in particular, many of our attendees on this call, we all work. And so this question speaks to employers. And it asks, how do I broach the conversation of my hearing loss with my employer? And what should I expect? How should my employer support me with my hearing loss?
Well, I've been working at Seton Hall Law School for 30 years, and I was hired 3 months after the enactment of ADA. And the dean that hired me, she was gang-ho ready. We will give you everything you need. She just had a willingly and supportive attitude. And you have to disclose it. Your employer can't help you if you don't disclose it. The law protects you. So they're required to give you the accommodations you need as long as it's not making a hardship for the employee. But most times it's not. However, it's up to you to self-advocate. You have to tell them that you have hearing loss or whatever, and this is what you need to succeed in the workplace. But you always have that law behind you to protect you. That won't be an issue for you if you can do the job.
Right. And it's the Americans with Disabilities Act, which covers the workplace. But it's up to the individual to disclose and to ask. And I know sometimes that's hard because you don't want to stand out. You want to do your job, you want to do it well. So that's what you need to say is, I need a caption telephone, or maybe sometimes you just need in a meeting for your coworkers to speak slowly and clearly. Maybe that's all you need, but you have to disclose with confidence and say, I just want to do my job well, and this is what I think I need.
And Barbara, I'm going to build on that just a tad. What if your employer comes back and they say, we don't have the money for that? What recourse would a person have?
Well, they are under law to make a reasonable accommodation.
Okay.
So they have to find another accommodation. But Letitia, I mean, if it's
Okay.
captioning, you know, they could have a speech to text app. If there's Zoom meetings, you can turn on captioning in Zoom.
Mhm.
So there's,
Accommodations are much better now than they were in the 90s. I mean, much better. So for that person to get to that point where the employer says they can't make an accommodation, you can self-accommodate yourself as well.
Oh,
And
okay.
that's important. You don't, if you really want to work, and while employers taking their time, they're not really providing you everything that you need, you can still work. You can take your own measures to accommodate yourself and not to knock away from not holding the employer responsible. But if you're in a position, you really want this job, you really want to work, and say they don't really have the money to give you, you don't really need live captions, somebody there. You can have it on your phone. We have it on a Teams meeting. You don't have to be live at the meeting. You can have the meeting on your computer. So there's really no room to say they can't accommodate you because you have your laptop, you have live Zoom captions, you have Teams captions, you have Google Meet captions, but they should be willing to support you to use all of those digital technologies or even in meetings. Okay, Letitia, we're having a meeting once you come. Will you bring your phone so you can use your Otter? We could pay for Otter for you each month if you're in meetings all the time. So there's so many ways that the employee can work with you where there shouldn't be any, we can't accommodate you because they can't.
and it maybe it's as simple as a job reassignment. Say you work in a grocery store and you're working as the person who checks people through the checkout line and it's noisy. Maybe you could be reassigned to the deli, you know, or the meat department or something where the sound is a little more controlled and it's less dealing with customers. And the ADA does not apply to companies with 15 or less employees. So it's important to remember that as well. Say you work construction and everybody wants to give you the directions on the construction site about your next assignment and the jackhammer is going behind you. Well, a reasonable accommodation may be that you step aside and go into the construction trailer and you get your written instructions for the day. So, you know, accommodation doesn't always have to mean a piece of technology or mean expensive, but some sensitivity to what the employer needs.
Exactly. Right.
Oh my goodness. This has been an awesome conversation. We are at 2:00 and I promise I wish we could go on and on. I myself have so many questions. And so with that, I'm going to invite you to come back so we can continue this conversation. Thank you. Just a wonderful conversation. Thank you so much, Letitia. Thank you so much, Barbara, and for all the awesome work you're doing at HLAA. Please come back.
We would be happy to. Thank you for inviting us. Thank you so much.
Awesome.
Thank you. And thank you again to our audience for your awesome, awesome questions. Thank you for coming and we give you your day back.
Okay. Thank
Have
you.
A good afternoon, all.
Thank you, Barbara and Angela. See you soon.
See you soon. Bye-bye.
Thank you.
Bye-bye.
Thank you
Really
all very
appreciate it.
much.
Bye-bye.